Morning everyone. We want to start this talk by trying to relate it to you practically. So if you are currently suffering from depression or anxiety, the objective is to help you identify some tips, some ideas that will enable you to recover, fully recover, and to be able to live in a normal sort of world. That's the objective for you. And to do that, I've got about 2 to 2.5 hours of sharing. It's hard to get across all the concepts, all the key ideas that are important for a recovery. But those conditions are recoverable, they are manageable in almost every case. I want to recommend the Depression Recovery Program and the material that goes with it. If you are interested in more detail, this DVD set by Neil Nedley is extremely valuable, and it's a lot longer than the sessions we'll be doing here. His program has a manual and also a textbook. This is a program that Steps to Life runs regularly and is quite detailed on the subject of depression. A lot of things that relate to depression do overlap with anxiety, as we'll discover today. And I'm hoping to point you to some other resources as we go through this talk to enable me to try and give you some more clues and ideas. If you don't suffer from depression and anxiety, then you can look at this as a vaccination program to enable you to learn some habits and some ways to so that doesn't hopefully come along in your life. And if you're here because you have a friend or a family member who is suffering, then hopefully you will be able to get some ideas to point them in the right direction or some materials that can help them. These conditions are very common. In fact, depression is supposed to be the commonest long-term, non-infectious disorder worldwide currently. So it's a very common disorder, and anxiety is probably right up there with it as well. So the main objective is to talk about, we'll define actually first what depression is. Most people are aware that depression is a mood disorder. It's a label, and the label does not tell you the cause. In medicine, some labels do actually give you a really good idea of a cause, but depression is a bit like saying you've got a headache, you've got a backache. It's not giving you a lot of ideas and cause. It refers to a mood that is despondent, that's down in the dumps, and usually there is a number of other factors that are associated with depression. In fact, to get clinically diagnosed with depression, you have to have it more than 2 weeks, and to also experience some other things like appetite suppression, loss of libido, loss of sleep, and feeling tired. Sometimes anger as well is one of the key features that can occur. So that's depression. Anxiety is a nervous disorder, again, and it's characterized by these feelings of apprehension, even sometimes impending doom, with no apparent obvious thing to, you're not got a tiger about to jump on you, but you feel like a tiger's about to jump on you. This is anxiety. Anxiety comes in a number of forms as well, which range from way out of control panic attacks to just general feeling of nervousness. We have all felt anxious at one time or another, and we've all felt depressed at one time or another. These are very common as short-term emotions, come and go. But it's when these things set in as full-on life experiences that are with us most of the time when they become a real disorder. There is a genetic connection with both of these. This is understood clinically. But it doesn't mean that you are doomed to get depression if your mum had it, or you are doomed to get anxiety if your dad had it. You need to get, in my opinion, at least 3 of these causative factors happening at once in order to get the initiation of depression or anxiety. But it is important, if depression or anxiety runs in your family strongly, then it's something that you need to be proactive about. Family history is very important, understanding your family background. The sleep-wake cycle is a big issue in today's society and is one of the other contributing factors that can relate to depression or anxiety. The main issue that we currently have and will have till further notice is technology. I call them techno evenings. We are having a lot of stimulation in our evenings. I tell patients that when you're going to bed at night, it is like landing an aeroplane. You've got to do it nice and slowly and gently. And too many of us are crash landing into bed every night after having a very stimulating evening on our iPads, iPhones, our internets, and other devices. I have talked to young people about this in my office. I had a 14 or 15-year-old in there not so long ago and asked him, what time do you go to bed? And it was getting close to midnight. Do you go on your phone at night? And yes, it's always the same. Yes, computer, Facebook, the social networks. It's very stimulating. And it's a problem that we all need to be aware of. In most cases, we need to take quite serious control in order for it not to slide out of control. A lot of people, their night time is they're shifting. And if you go to bed after midnight and don't get up till lunchtime, you will not recover from depression. You have to get that cycle back into some kind of normality in order to recover fully from depression. And it can't be done quickly in many cases. Sometimes you do need special help at a retreat or with some supplements. But sleep-wake cycles is an issue that can commonly compound depression in particular, also anxiety to a lesser degree in my clinical experience. I actually have a rule when it comes to using the computer, that I have a rule. I won't go on the computer, on the internet after 8 p.m. unless it's an emergency. Okay? I'm aiming for bed at 9. Okay? 9 to 5 is what I aim at. I don't achieve it necessarily every day, but so I have a rule. Unless if we got a storm coming, I want to know if there's hail or something, well, I'll get on and check. Or if there's some other emergency, but otherwise that's my rule. There are a number of medical conditions that have anxiety or depression as they piggyback those medical conditions. They tend to be often associated. For example, thyroid disorders. If you've got an underactive thyroid or an overactive thyroid, it's very common to have anxiety or depression as an add-on. I might talk more about that later on. Heart disease, so for example, if you've had a heart attack, it's common knowledge in medical circles that depression is associated with recovering from a heart attack. In fact, depression also is a risk factor for heart attacks as well. So there's a connection there. A lot of connections. Chronic pain, of course, is a big one when it comes to depression or anxiety. If you suffer from chronic pain, then that's an important one, and we may come back to that. Trauma. Trauma is an important factor as well. If you've had a head injury and been knocked out, then you will get depressed. It will happen if it's been bad enough. The worse the head injury, the worse the depression. In fact, standard medical advice, if you go to a GP and have had concussion, is that we will tell you that you're going to suffer from irritability